Hello everyone, welcome to my Study with Little Scientist YouTube channel. So in today's video, I would like to study about wound healing chapter, which is a sub-chapter of pathology. And this video will mainly be very useful for all junior doctors who are planning to sit RCEM primary exam. So my channel is mainly for exam purposes, so for the notes, I'm not going very deep and detailed rather than trying for the exam purpose cleared and memorizable. Okay, so now let's start studying. So regarding wound healing, the first thing that you need to know is the 4 phases of wound healing. And the sequential order is really important. And phase 1 is homeostasis, and phase 2 is inflammation, and followed by phase 3, proliferation, and then the last one, phase 4, is remodeling. Now, the second key note is about the migration of fibroblasts into the site of wound or the site of injury. So these fibroblasts starts migrating into the injury site or wound site, especially 2 to 5 days after injury. And this time frame is important, and later you will see some questions related to this in RCEM success primary substitution question banks. Okay, now let's go to the next one. So this keynote, it's about the timeline of predominant inflammatory cells for wound healing process. So wound healing process is mainly mediated by inflammatory cells, and there is a specific timeline for specific inflammatory cells. So from day 0 to day 2, neutrophils are the predominant cells that mediate the early wound healing process, and starting from day 3 and onwards, macrophages are the main inflammatory cells for wound healing. So the next keynote is regarding stable cells. So the examples of stable cells are liver cells, also known as hepatocytes, renal tubular epithelial cells, endocrine cells or endocrine gland cells, and smooth muscle cells. You need to memorize these 4 stable cells for exam purpose. Now let's go to the next page. So this key is regarding about the primary intention or primary union healing or first intention healing process. So there are 2 types, first intention healing and second intention healing. And this note is about the advantages of first intention or primary intention healing process. So there are 2 advantages, which is minimize scar formation and faster healing time. Now let's go to the next one. So previously we have already learned the examples of stable cells. Now we are going to learn the examples of labile cells. So the first one is epithelial cells, which includes epithelial cells of skin, GI tract, respiratory tract, urinary tract, and uterus. And the second example is bone marrow hematopoietic stem cells. And the third one is lymphoid tissue cells. And the fourth one is germ cells. So all these 4 types of cells are called labile cells. Alright, let's go to the next page. So the next keynote is about the fracture healing. So in this note, what's important is the function of the osteoblast versus the function of the osteoclast. So the osteoblasts, they are involved in osteoid synthesis and they are important for laying down of osteoid or bone tissue during the fracture healing process. Whereas osteoclasts, they are the opposite function, which is the breakdown or the resorption of the osteoid. But both osteoblasts and osteoclasts, they are very important and much needed for the fracture healing process. Now, let's talk about the next keynote, which is regarding the role of collagen in wound healing. So the collagen, their main role is mainly for the structural scaffold for the wound healing. So the scaffold means it provides the strength and support in wound healing process. And these collagen, they are mainly predominantly synthesized by fibroblasts. Now let's go to the next page. And this keynote is about the mature scar tissue and also the immature scar tissue, or the early stage of the scar tissue formation. So mature scar tissue, they are mainly formed by type 1 collagen, and the early or immature scar tissue, they are predominantly made by type 3 collagen. So you need to memorize and remember mature scar type 1 collagen and immature scar type 3 collagen. Okay? Now let's go to the next one, which is about permanent cells. So permanent cells, they are also need to be memorized and remember for your exam. And these permanent cells, they cannot regenerate after damage or injury, and they are really important cells. So the first one is brain cells, the second one is the myocardial cells, and the third one is skeletal muscle cells. So for the RCEM primary exam, you really need to remember and memorize the examples of stable cells, labile cells, and permanent cells. And you will see some questions in the question banks when you tackle later after studying with me in RCEM Success Subscription account. Okay, now let's talk about the next keynote, which is regarding the skeletal muscle cells damage. So when the skeletal muscle cells are damaged, satellite cells are stimulated to divide. However, skeletal muscle fibers, they are not stimulated and they cannot be divided. So that's the main difference that you need to remember and memorize for exam. Whenever skeletal muscle cells are damaged, only satellite cells are stimulated to divide, whereas skeletal muscle fibers cannot divide. Alright, now let's go to the next one. So this one I have already mentioned in the previous keynotes. So in early wound healing or immature scars, they are mainly consist of type 3. So as a recall, for mature scars or late wound healing, they are mainly consist of type 1 collagen And for early wound healing or immature scars formation, they are mainly consist of type 3 collagen. Now, let's go to the next keynote, which is regarding one of the permanent cells, which is brain cells. Because they are permanent cells, they cannot regenerate efficiently or significantly after injury. So now let's talk about the next one, which is the maximum strength of scar, which is the maximum tensile strength of scar compared to the normal skin or the normal and wounded skin. So even though whenever there is an injury and scar formation happens, even though the body mechanisms try to substitute and try to make as normal as possible as before, still whenever there is a scar, it will reduce to 80% tensile strength of normal and wounded skin. So they cannot fully reach 100% back to the normal, but still a good scar, their maximum strength is 80% tensile strength of the normal and wounded skin. So alright guys, so this is all the main keynotes for the wound healing topic, which is the sub-chapter of pathology for RCEM primary exam. And I really hope that you will get a lot of knowledge and information, and my keynotes and studying together with me will help you pass your RCEM primary exam preparation and results. Alright guys, thank you so much for watching until the end, and see you in my next video. Bye!